Hello, dear friends and colleagues. My name is Konstantina Theodoratou, and first of all, I would like to apologize because finally I couldn't join your wonderful Congress because of family problems. I hope that next time I will be with you. I'm a general doctor, but also I use acupuncture in my everyday clinic, and I represent also ICMAT. I'm the General Secretary of ICMAT. Today, my topic will be on preventive medicine, the importance of preventive medicine, and we will see if we can use medical acupuncture in order to work with prevention. So why do we talk about prevention? I would like to show you at the beginning some numbers from the World Health Organization, the official numbers, about what happened in medicine. As you can see here, we have some many deaths around the world from some very simple problems, as we think, like high blood pressure, tobacco use, high blood glucose, physical inactivity, and overweight and obesity. These causes are really very important because if we do not treat them, then we have chronic disease such as heart diseases, diabetes, and many different types of cancers. So if we do not prevent these causes at the very beginning stage of them, then it is sure that we're going to have these chronic diseases. And this happens in all countries around the globe. We call them non-communicable diseases, NSD. And as we said before, includes the heart diseases, stroke, diabetes, cancer, lung diseases, etc. And these type of diseases are responsible for the 70% of morbidity of the deaths around the globe. The important thing here is that if we can if we can detect them at the beginning, we can even prevent them. So that means that we will never have chronic diseases or deaths from them. I found in WHO webpage that 10 years ago we had 55 deaths, and from those deaths, the 30% were from these chronic diseases. If you can imagine that the last 3 years we suffered from COVID, and from the beginning of COVID till yesterday, May 24th, we had less than 7 million of deaths. So you can imagine how important it is to prevent these chronic diseases. In medicine, we know this. We noticed the recent years, and that's why in some countries we already have a specialty called preventive medicine. And what do we do in this kind of medicine? A special training from different specialties of medicine, but we are focuses on prevention. That means on the health of the people and the communities. That means air pollution, for example, or habits. So we do promote health, and what we learn is how to keep people in health and not just treating the diseases. So we try to detect and treat all disharmonies before the diseases. This is really, really very important. And in between health and the symptoms or the disease, we have a lot of time. It is a lot of time from the first signs until the disease, or even worse, the chronic disease. So we have time to apply some modalities in order to prevent health and not to treat symptoms. If we look at those diseases, the chronic disease, we can see that there is some common symptoms behind them. And we do know today that chronic inflammation, stress or stress-related symptoms are really very important for the creation of these symptoms, or even worse, to have behaviors that are behind the symptoms, and finally the disease. So we can think that sometimes we have some lifestyle choices that do not improve our health, and doctors are responsible to notify them to their patient and try to treat them. Let's go to see what do we know today from science and from research. First of all, about chronic inflammation, sometimes with symptoms, sometimes without symptoms. We know that is really very important for keeping health, because if we do not treat, then we have these diseases that are related with inflammation, like cardiovascular diseases, diabetes, cancer, etc. But it's not only this. We have related this chronic inflammation with also many mental problems. That means chronic stress has also chronic inflammation behind it, and many more other. We call it sickness behavior when we have a chronic inflammation and has some specific symptoms. So it's really very important to take a very good medical history when we first meet our patients and try to understand if there are some asymptomatic signs that we have this chronic inflammation behind the words of our patient. About stress, we also know a lot recently. We know that even stress is related with the epigenetic changes in our DNA. We know that we have oxidative stress, and we have this shortened telomere length, which is really very important for aging, but also for creating these chronic diseases. It is really important now to see if acupuncture can prevent diseases or can only treat symptoms. If we start from the beginning, the ancient period, the traditional theories told us that acupuncture is a balancing mechanism at the body that keeps the energy of the body in balance and homeostasis. So that was the first idea. And also they told us that the man, each person, if it is balanced, then that means that it is also balanced with the exterior, with the area that we live. And that means that the ancient just talk about balance between nature and balance inside our body. So traditional theories were very nice. If we just focus on 3 different sentences, you see at the first one, they told us that we have to keep balance between us and the nature. And this is why we should follow the planet and different temperatures of the year, to eat different things depending on the time of the year, etc. Something that we have destroyed a little bit in the modern world. Then they said that we have to keep balance between different systems inside our body. They call it Chang Fu systems or Chang Fu functions, but they said that every organ, every system of our body should be in balance in order to keep and maintain health. And finally, they talked about the mental health, and they said that if we are in a balance, then our emotions will be in a balance, and then every person will be balanced. And the same for our activity, mental activity or body activity. So balance was something that was mentioned really very important the old years. Let's go to see what we know today. Today, we have very good medical guidelines on acupuncture for many, many different diseases. This nice work, it was published a few years ago in 2018, and it was a screen actually about publications on acupuncture treatments, and they found 2,189 positive recommendations for acupuncture in different health problems. So that means that we safely can use acupuncture to treat health problems. But what about preventing this kind of problems? One very nice work was published 2 years ago in neuroscience, and it was held in Harvard University, and it was in this work, in this study, they tried to see if there is a connection between prevention and inflammation. So what they did, they produced one inflammation in some animals, and then they tested the reaction of the body. And they found that if we apply acupuncture before we produce the inflammation, then we have 80%, between 20 and 80% better results and less inflammation. Comparing to if we apply acupuncture after we produce the inflammation. So that means there is a preventive function of acupuncture if we apply it before, in advance, the symptoms. And this is very important for us because sometimes we see people without diseases, but with many symptoms. And if we keep them under our treatments and we prevent and we control these abnormalities, most probably they will not have later on in their life chronic diseases. Same happens with stress. We have many publications that we know and that show us that acupuncture works on nervous system and can release all neurochemical messages related with stress. And finally, what we have seen recently is that acupuncture may activate different brain areas in order to keep balance between different parts of the brain. And this is very similar to what the ancient Chinese, the traditional Chinese theorists told us, that the most important thing is to keep balance in order to maintain health. Something also very new today is about aging. We say that getting older means that we have a lot of inflammation in our body. So from research also, we have seen that acupuncture through metabolomics and through cell biology can control this aging function in our body. And most probably it is published that anti-stress biology by acupuncture, maybe it's a very good preclinical practice for anti-aging. So this is a really very important, published by Western Medicine of Preventive Medicine. Something also very new, it was a publication after the first year of, during the first year of COVID, when the Chinese applied acupuncture for prevention to healthy people, but also for treatment. And they published some results that they also had good results for prevention. They tried to strengthen the immune system of the body and the respiratory tracts or the lungs. And then they said that they had better results on that. We also have some other publications on prevention, for example, for headaches or migraines, comparing with Western prophylactic drugs. And we have seen through that, of course, acupuncture may reduce the attacks of migraines if we apply acupuncture when we do not have the pain. That means we do not just treat migraine the time that the person has the migraine, but we call them to come when they are free from symptoms, and we do this kind of treatments in advance in order to reduce their symptoms. And sometimes in clinics also, we very well know that we can stop the migraines in some people. So if I would like to conclude, I would say that it's not new that prevention medicine is really important. I am coming from Greece, and we had the theories of Asclepius and Hippocrates when they said that we have to live in a natural way, close to the environment, and we need to prevent diseases. And this is very, very similar to what the traditional Chinese theory said, that we have to balance our energy and to live in balance with the environment. So today we don't say something really new, but we have to focus on that, because in Western medicine, we've forgotten that for many years. So we need today to focus on prevention and balance. And we need to focus more to the individual people, not to generalize the medicine. We have to be proactive, so we have to do preventive treatments to our patients in order to control all these kind of chronic diseases. And yes, acupuncture is a safe tool. It's we know, we are sure today how it works, and we can use it in medicine in order to control this very big problem of chronic disease. Thank you very much for your attention. And if you want something, or if you have some questions, you can mail to me. If you Google my name, you will find my email address. Thank you very much, and wish you all the best. Thanks to the organizers for the invitation. And I promise I will be with you in 2 years' time. Bye.